Venlafaxine is a selective serotonin and norepinephrine reuptake inhibitor, SNRI, used for the treatment of major depression, generalized or social anxiety disorder, and panic disorder. In this video, let's found. What is venlafaxine? What is venlafaxine used for? Contraindication. What are the side effects of taking venlafaxine? How does venlafaxine work? How to use venlafaxine? What is venlafaxine? Venlafaxine, sold under the brand name Effexor among others, is an antidepressant medication of the serotonin norepinephrine reuptake inhibitor class. It is used to treat major depressive disorder, generalized anxiety disorder, panic disorder, and social anxiety disorder. Venlafaxine was approved for medical use in the United States in 1993. It is available as a generic medication. In 2020, it was the 43rd most commonly prescribed medication in the United States, with more than 15 million prescriptions. What is venlafaxine used for? Venlafaxine is indicated for the management of major depressive disorder, MDD, generalized anxiety disorder, GAD, social anxiety disorder, SAD, and panic disorder. Contraindication. Venlafaxine is not recommended in patients hypersensitive to it, nor should it be taken by anyone who is allergic to the inactive ingredients, which include gelatin, cellulose, ethyl cellulose, iron oxide, titanium dioxide, and hypromellose. It should not be used in conjunction with the monoamine oxidase inhibitor, MAOI, as it can cause potentially fatal serotonin syndrome. Side effects. Feeling sick, nausea, stick to simple meals and do not eat rich or spicy food. Sweating and hot flashes. Try wearing loose clothing and using or a fan where possible. Headaches. A dry mouth. Feeling dizzy. Feeling sleepy. Being unable to sleep, insomnia. Constipation. Pharmacodynamic. Venlafaxine is an antidepressant agent that works to ameliorate the symptoms of various psychiatric disorders by increasing the level of neurotransmitters in the synapse. Venlafaxine does not mediate muscarinic, histaminergic, or adrenergic effects. Mechanism of action. The exact mechanism of action of venlafaxine in the treatment of various psychiatric conditions has not been fully elucidated. However, it is understood that venlafaxine and its active metabolite O-desmethylvenlafaxine, ODV, potently and selectively inhibits the reuptake of both serotonin and norepinephrine at the presynaptic terminal. This results in increased levels of neurotransmitters available at the synapse that can stimulate postsynaptic receptors. It is suggested that venlafaxine has a 30-fold selectivity for serotonin compared to norepinephrine. Venlafaxine initially inhibits serotonin reuptake low doses, and with higher doses, it inhibits norepinephrine reuptake in addition to serotonin. Venlafaxine and ODV are also weak inhibitors of dopamine reuptake. Half-life. The apparent elimination half-life is 5 plus or minus 2 hours for venlafaxine and 11 plus or minus 2 hours for ODV. Dose. Major depressive disorder. Indicated for treatment of major depressive disorder, MDD. Immediate release tablets. 75 mg per day, PO divided Q8-12HR initially, may be increased by less than or equal to 75 mg per day faster than every 4 days. Moderate, up to 225 mg per day, PO divided Q8-12HR. Severe, up to 375 mg per day, PO divided Q8-12HR. Extended release tablets or capsules, HCl salt. 37.5 to 75 mg PO once daily initially, may be increased by 75 mg per day every 4 days, not to exceed 225 mg per day. Extended release tablets, benzoate salt. Do not initiate treatment with venlafaxine, benzoate extended release tablets. Other venlafaxine extended release product for initial dosage, titration, and dosages below 112.5 mg q day. Can be initiated at 112.5 mg per/day in patients who have received greater than 75 mg of another venlafaxine extended-release product for at least 4 days. Not to exceed 225 mg per day. Generalized anxiety disorder. Indicated for treatment of generalized anxiety disorder, GAD. Extended-release tablets or capsules, HCl salt, 37.5 to 75 mg per once daily, may be increased by 75 mg per day every 4 to 7 days, not to exceed 225 mg per day. Extended-release tablets, benzoate salt. Do not initiate treatment with venlafaxine, benzoate extended-release tablets. Use another venlafaxine release product for initial dosage, titration, and dosages below 112.5 mg per/day. Can be initiated at 112.5 mg per/day in patients who have received greater than 75 mg of another venlafaxine extended-release product for at least 4 days. Not to exceed 225 mg per day. Social anxiety disorder. Indicated for treatment of social anxiety disorder, SAD. Extended-release tablets or capsules, HCl salt 75 mg per once daily. Dosages greater than 75 mg per day not to be more effective. Panic disorder. Indicated for treatment of panic disorder, with or without agoraphobia. Extended-release tablets or capsules, HCl salt 37.5 mg per once daily for 7 days, then 75 mg once daily, may be further increased 75 mg per day every 7 days, not to exceed 225 mg per day. Safety advice. U.S. FDA Pregnancy Category C. Animal reproduction studies have shown an adverse effect on the fetus, and there are no adequate and well-controlled studies in humans, but potential benefits may warrant use of the drug in pregnant women despite potential risks. That's all the information about venlafaxine we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.